Welcome, dear student, to your Medico Apps Masterclass. I'm Dr. Sarosh. We're going to talk about a new topic, disease causation, measurement, and the milestones. Let's begin. The theories of disease causation. So it's the first began within the very early times by Aristotle. Remember? So he gave the theory of spontaneous generation. That is, disease is caused spontaneously. Then came Louis Pasteur and he gave the theory of germ theory. Then Patent Coffer. Coffer, he said it's multifactorial. Then McMahon and Pogg, both of them said, no, it's a web. It's like a causation web. So web of causation theory is put forth by him. Both of them. The epidemiological triad is nothing but agent, host, and environment. They're all showing interacting with each other, right? Whereas the triangle, important question, what's the difference? Triangle will have the same agent, host, environment, but also the time and the center. Advanced model of epidemiological triangle, because we know now many non-communicable diseases doesn't have an agent. So for that purpose, agent is replaced by the causative factors, okay, like environmental, nutritional, genetic, psychosocial factors. We'll take a diagrammatic view of each of them: the triad, agent, host, environment, triangle with the time in between. Here we have time, and then we have the advanced epidemiological triangle with various causative factors. All right. One good mnemonic for you all. Its being model is nothing but all the factors compiled together, okay, like biological and behavior, environmental, immunological, nutritional, genetic factors, and social, service, and spiritual factors. If you can remember very easily, beings as a mnemonic is a beings model. All right. So let us talk about Hill's criteria. So when we are talking about, when we are doing any research and telling that smoking is causing that cancer, is the cause of cancer, there needs to be a few criteria which needs to be fulfilled. Okay. So if you say it's a association between smoking and cancer is true, then we have to prove that it is having temporality, the first criteria. Okay. That is, the cause is preceding the effect, that is smoking is preceding the cancer. Yes, that's true, and that is established by follow-up study or prospective studies like cohort study. It's a question for you. Most important criteria. Okay, the specificity is disease is caused only by particular risk factor. Most difficult criteria. Again, a question for you. Most difficult question of criteria to establish is specificity in his criteria. Consistency. Results must be replicable in different settings. So if you do repeat the study in the different place or state, the same results needs to be got. So strength is given by relative risk and odds ratio. The strength of association matters. Biological plausibility. Plausibility here means it should be rational, explainable scientifically, because smoke goes inside the lungs and causes the irritation of the beautiful mucosa inside epithelium and causes a change in the cell DNA and resulting in cancer. That is scientifically explainable, right? Coherence, like it should be relevant. That is, for example, we have found out that there is also an increase in the tobacco usage by people, and thereby there's increase in the lung cancer at the same time. So that particular thing is correlating or having a coherence. All right. The two more criteria we'll discuss. One is dose relationship, response relationship, that is increasing the dose, having the increasing response. So more than smoking, more risk of cancer, that kind of association. And finally, cessation of exposure. So if you reduce that exposure, that should reduce the incidence. So all these criteria, for example, for smoking and cancer, it rightly fits. So remember that one. Total 8 criteria for Hill's also known as Surgeon General's criteria of causal association. All right. Let's see the tools of measurement in epidemiology or epidemics. Okay. One, very simple. This is very important concept here. Okay. One is rate, where A divided by B into a multiplying factor like 1,000, 10,000, 1 lakh. Okay. Rates are most commonly used. Okay. Here A is a part of B, that is at the numerator and the denominator. If you see, the B is also having the numerator in it. Ratio, whereas A by B is different, A is different. Okay. Proportion, yeah, like A by B into 100, that is given in percentage. Here also the numerator is a part of B. All right. We'll take some examples also. Rate, like incidence rate, right? In incidence rate, you have the new cases of diseases divided by total population. If you see, the numerator is already included in the denominator also, multiplied by multiplying factor. Therefore, we call it as rate. Prevalence, whereas it has new and old cases divided by the total population, multiplying by multiplication number, that is 100. Remember, 100 is for proportion. Finally, the sex ratio, the ratio that we spoke about, where A is not a component of B or numerator is not there in the denominator, like this, males and females, and multiplying factor into 1,000, that is ratio. Is it okay? The present sex ratio, if you can see, it is represented as 953, so 943 females per 1,000 males. Okay. The case fatality rate, the name itself is rate, but you can see the multiplying factor is 100 here. The number of deaths divided by number of cases. It's a proportion. Case fatality rate is 100% for rabies, right? There's no cure for rabies once onset is there. And case fatality rate for Japanese encephalitis is approximately 30 to 35. That means there are 30 deaths. If there are 100 cases, there are 30 deaths. Then infant mortality rate. So number of infant deaths divided by live births, right? That multiply by a multiplying factor, that is rate. Maternal mortality ratio, that is number of maternal deaths divided by total live births. If you can see, denominator and numerators are different. Therefore, we call it as ratio. Multiplying factor here is 1 lakh. Remember? Clinical trials, the last slide for today, that is father of epidemiology is John Snow. Modern epidemiology is also John Snow. Father of medicine is Hippocrates. First true epidemiologist also Hippocrates. So epidemiologists, don't get confused. Okay. First distinguished epidemiologist is Sydenham. That is Sydenham, Korea, if you remember that person. It is first distinguished epidemiologist. Father of public health is cholera. A very confusing question, many times asked. Cholera itself has led to the public health development. So father of public health is cholera. Finally, where is the location of National Institute of Epidemiology? That is Chennai. All right. Let's see you in the next class. Thank you so much. Take care.